Good morning, everybody. Thanks so much. Here, let's get this so they can see Kevin and I. Thanks so much for coming. I wanted to introduce myself. My name is Kim West. I am with Senior Benefits Plus. We are one of the partners here on this webinar this morning. And naturally, we always got to get ourselves going a little better here. I wanted to go ahead and introduce my staff. For those of you that work currently with me and Marlena, I'm going to just kind of tell a little joke. We are not mother-daughter. She just happened to marry somebody with my same last name, although she is like a daughter to me. Many of you might have spoken to Christy Genero. She is also a licensed agent in the office, and our newest agent is Gabe Assad. Also want to introduce my partner in crime over here, Kevin Cox. He's with Medicare Reimagined.
Awesome. Thank you, Kim. Very quickly, I just wanted to introduce myself. I know we have a mixture of folks here on this webinar from that I work with directly within my agency, that Kim works directly within her agency, and then also our sponsor for this event or webinar today, Village Medical, invited their patients as well. So quickly, a little bit about myself is that I am a licensed agent or broker. My office is in Livonia. So for those of you that go to the Village Medical office that is at 6 Mile in Newburgh, I'm about a mile down the road. As folks that are on here know, that we work with individuals across the state of Michigan, and we help them understand and navigate the Medicare program, the changes and things that you need to do to make sure that you're secured with the health care that you need. So we are very excited to have you all here. Very quickly, this is going to be interactive. So if any of you have questions, at the bottom of your screen, there's a little Q&A tab that you can click on. If you want to type the questions in as we go, we will address all of them towards the end of this presentation. The presentation itself should take about an hour to get through, but we're excited to have you here. Before we get started, is there anything else you want to add, Kim?
Nope, I want everybody to kind of sit back and relax. I want you to go ahead and make some notes. As Kevin said, we'll address all your questions at the end of the presentation. And I just look forward to everybody being here. This is it, it's a crazy time of year for us. We're just thrilled that so many people came on to this webinar to learn about this. And hopefully you have some great questions for us, and hopefully we can answer everything that you guys are looking to have answered.
Great. So very quickly with mentioning the sponsors for this event. So we are doing a webinar, and then as you noticed, Liberty Richie, we have two in-person events later this week. So Village Medical is a primary care physician office with several different locations that we partner with locally here. And we just want to let folks know that if you're ever in the market looking for a new primary care physician, they have several offices around Southeast Michigan. Some of the reasons why some of our clients do like Village Medical is because they have more of a concierge type of a feel. Often they will give folks same or next day appointments, very hands-on. I think they, will sit in the office and have a longer conversation with you versus an in and out type of a relationship with your provider. So if you're ever in the market looking for a new primary care physician office, definitely check out Village Medical, because they work a little bit different than the traditional primary care physician that you might be familiar with.
And one thing I want to throw in that I think is really a unique feature that they do is they actually have a huge diagnostic center in Novi where you can actually go in there and you can get a mammogram done quicker, you can get lab work done quicker, and that's all part of Village Medical. So it's kind of a nice way to address healthcare, is what we have seen with working with them and having some of our clients utilize them.
And then as you can see, Google reviews tend to be very high, so patient satisfaction is their main focus, and the reviews show that. All right, so let's jump into the presentation. As you all know, we are getting ready to enter the open enrollment period. The commercials are going to start here on the 1st of October, the radio ads, the direct mail. So this is the window where, as you all know, for folks who are already on Medicare, this is your period to make any changes you'd like for the upcoming plan year. The goal of this presentation is really to help individuals who are on traditional Medicare with a Medicare supplement and a Part D drug plan, understand what's kind of happening in that market, and then to also address what alternative options that you can choose from if you want to try additional type of coverage that's offered through the Medicare program. So what we're going to go over first is some of the upcoming changes to Medicare, what we know today. And as you can imagine, Medicare being a federally funded program, things can change from minute to minute, day to day. So we're going to share with you what we already know.
Which I want to interject, we
Sure.
don't have the plan information just yet. That is actually released to us as well as everybody on the webinar and everybody October 1st. So we're doing our best to get the snippets of information, but we do not have all of the plan structures and everything just yet. But October 1st, we will.
What we'll also go over is what the Medigap changes are that we know and the trends that you're seeing in the landscape. We'll talk about Part D trends and changes, and then we will go over Medicare Advantage to help those of you get a better idea of what that program is. And if it's something you're interested in, we'll go over next steps and how you can explore that further. So what we know that is changing. So if we move through, as you know, Social Security Administration gives the annual cost of living increase, which is known as COLA. We don't know what that exact number is, but the projected amount for 2026 is about 2.7%. And so when you look at that average over the 10-year span, it's approximately about 2.8%. So you're looking at about a 2.7% bump or an increase in your Social Security benefit for next year. What does that equate to? So the average Social Security benefit, now some of you on this webinar might have a lower amount, some might have a higher amount, but the average beneficiary receives about just over $2,000. So if we're going to get a 2.7% increase, that's about an additional $55 a month, which gets them to just over $2,061 as their new monthly Social Security benefit. And as you know, if the government's giving you money, they're taking it back in another form. So what is the projected increase for the Part B premium? This is projected to be higher than normal year. So we are anticipating, based on the current Medicare trustees report, that the Part B premium is going to increase to $206.50. So as you recall, all of you, if you are at the standard amount, meaning you are not a higher earner and being charged what's called IRMA, you would each be paying $185 a month for Medicare Part B today. That is anticipated to go up to 206. So I just showed you on the last slide that the average Medicare beneficiary receiving Social Security is going to get about an additional $55, $56 a month. And now they're going to take back about $22 of that. All right, so you can see the dollars being spread and there's not much to go around. So outside of the Part B premium increase, which is typically taken out of your Social Security benefit or you get billed quarterly, there's also the Part B deductible. So Kim, if you want to move to the next slide. So currently the Part B deductible is $257. So for those of you that are on Medicare supplement plans, such as Plan G or Plan N, you know that you are responsible for the first $257 for the year, and then your supplement plan will kick in and start to pick up the additional cost that Medicare doesn't cover. They are anticipating that Part B deductible be increased to $288. So it's a $31 increase annually for the Part B deductible. So as you can see, we've only gotten through a few slides so far. Everything is going up. And this is the stuff that we want you guys to understand as you're preparing on what your budget is and what you're looking for, what you want to do with your healthcare as we go into 2026.
This is the whole reason why we came together to actually do this curious about Medicare Advantage, because we are getting closer and closer, it seems, to be able to investigate it. Is it going to work for you guys? And it's just time to talk about moving forward with something like that if possible.
All right, so let's move forward to Part D changes. Let's go over what we already know. Currently, So as you remember or recall, this calendar year in 2025 was the very first year that there was an annual out-of-pocket maximum for Medicare beneficiaries with prescription drug costs. So as you know, what that means to you is that if you had hit a threshold of $2,000 that you've spent out of pocket on medications this year, you were covered at 100% by your prescription drug plan for the remainder of the calendar year. That threshold or that dollar amount is increasing to $2,100 next year. So starting in 2026, your Part D prescription drug cap is $2,100. If you, as the beneficiary, hit that threshold, that does not mean that you no longer have drug coverage. That means that the Part D insurance carrier that you are enrolled into has to now cover you at 100% for the remainder of the calendar year.
And for some of you, if you remember back in the day where I used to call it like the roller coaster, where we had the deductible, the coverage gap, the catastrophic coverage, well, that all went away last year. So that's where the first 2,000 cap came in. And then, as Kevin just mentioned, now it's going up to $2,100 for 2026. So no more roller coaster ride.
Yes. The second thing we do know is the deductibles going up. So what CMS, the Centers for Medicare and Medicaid, says is that you are allowed to put a deductible on the plan, but it is not allowed to exceed $615 for 2026. So you will not find a prescription drug plan out there with a higher deductible than $615 because it is not allowed by the federal government. So you can see that that's a $25 increase from 2025. You are going to see, as you will be able to look at the 2026 plan starting on October 1st or later, that the deductible is going to vary. Some might not have a deductible, some might go all the way up to the 615, some might have a reduced deductible, and then some of them will play the game of where they will say the deductible only applies to certain tiers. One of the more popular Part D plans that some of you are probably a fair share of you have on this webinar today is the WellCare Value Script, which is a $0 Part D plan. As you know, with that plan, there is a drug deductible of $595, but it does not apply to Tier 1 or Tier 2 drugs. Going into next year, they have changed that. The deductible is $615, but it now, so if you're taking Tier 2, it is going to be subject to the deductible on the plan. So there's a lot of different things that are changing that you need to be aware of. So that way, when you go to the pharmacy counter in January, you're not surprised at what the cost is to grab the or to get the medications that you need. If there is anybody in the webinar today that is enrolled into the Medicare prescription payment plan, what that is that individuals who have very expensive prescriptions are allowed to opt into the payment plan to where they don't pay anything at the counter for their medications. They get billed by their insurance carrier, and the insurance carrier divides the cost of their medications up over the remaining calendar year months. So it's a way for someone to not have that big sticker shock of a very expensive medication. The insurance company will spread it out so you can pay it off over time. If you are if you are enrolled into that prescription payment plan today, you will automatically be re-enrolled into it for 2026. If you want to opt out of it, you must request that manually by calling your prescription drug plan, and they have 3 days to process that request.
Question, just because I want to ask a question. So in that 3 days to process, are you talking about now January 1, 2026? Is that when they can opt out, or are we talking beforehand?
So they can opt out beforehand and say, I want to stop participating in it in 2025, and then that would just roll over into 2026.
Okay.
And if you change your prescription drug plan and you do want to opt into this program, you need to opt in with the new Part D plan that you are enrolling into.
Okay, cool. Yeah, I just kind of wanted to clarify that.
Awesome. And then the fourth bullet you see on here is the drug price negotiations. So several years ago, there was the Inflation Reduction Act that passed. There were several different components to that legislation. And now coming in and directly negotiating prescription drug prices. for Medicare beneficiaries. And so this is the very first year where you as a consumer, you as a beneficiary, if you are taking any of the medications that are part of this negotiation, you will see a reduction or a savings in your medication. What those prescriptions look like, but I just want to mention the last bullet here. So you can only imagine there's change to this plan and the Part D coverage every year. So you need to anticipate plan changes, plan exits, premium increases. So I'll give you another example, and some of you are already probably starting to receive your annual notice of changes in the mail from these insurance companies. If you're on, let's say, the Cigna healthcare saver plan, which is 40 cents a month. That has been sold to a company called HealthSpring, and you're getting mapped over to a plan that's going up to $50.40 a month. So there's a lot of volatility, there's a lot of changes. You need to open the mail and pay attention to what's going on so you are not going to be shocked come January 1st when you need to go use your healthcare and you don't understand what you have there in your wallet.
Between Kevin and I and Marlena and our staffs, we have mailed out information in regards to this, but we truly, truly need to make sure you guys do open up that annual notice of change this year. It is going to be very, very important. The Aetna plan is also having a dramatic increase, so you can't just assume that you're going to be fine. And each year we reach out to you guys. I know at Senior Benefits Plus we do. I know Kevin's very diligent with his clients. So it's a big part of the open enrollment. Please make sure you open that stuff up. If you haven't sent back your client survey, because we've been working on those with everybody, please make sure you do that. We will take care of you guys. We will check these prescription drug plans. But again, it's going to be a very exciting year. So we just want to try to make sure we've got all the paperwork in so we can start running as soon as we know what's going on.
Yeah, absolutely. So we need your help. We need your participation. We know that you guys give us that information and it seems like it's repetitive, but to give us the fresh data every year lets us know that nothing's changed with your prescriptions, or maybe you're not taking certain ones anymore, or maybe you changed your pharmacy, which allows us to give you the most accurate quote for your prescription drug coverage going into 2026. So please fill that information out, even if it feels like you just filled it out 6 months ago.
Last thing I want to say on that too, as you can tell, we're kind of really adamant about this. Try to make our lives as easy as possible. We have to get through quite a few of you guys fairly quickly. And the more information that's in there that's correct, thank you in advance. That just helps us move through you guys much more faster and we can get to everybody.
Yes, thank you. All right, so let's take a look at some of the list of the first 10 drugs that are part of that negotiation program with the federal government and the pharmaceutical manufacturers. So you're going to see some pretty popular prescriptions on this list, like Eliquis, Farxiga, Januvia, and Trusto. These are, on the very first column, what the new negotiated rate is going to be. Now, that's not what you're going to pay. That is what the cost or the retail cost of the prescription is. That dollar amount is then divided up between you and the Part D prescription drug plan you're on. So let's use Eliquis as an example, right? That's the third from the last one down at the bottom. Today, the average Part D or the average price for a 30-day supply of that prescription is $521 a month. That is being reduced by 56% and going down to $231 a month. So for those of you that are taking one of these 10 drugs that are very, very expensive, you are going to see relief as you go into the calendar year of 2026. This list is going to continue to grow, but these are the first 10 that they've focused on, the federal government, to try to reduce costs for you as the Medicare beneficiary.
And when we start talking about Medicare Advantage plans, that's where you'll see too, where some of these prices can actually get a little bit more affordable as well when it's all part of a Medicare Advantage plan, as opposed to being a separate standalone prescription drug plan. You good with the screen?
Yes. All right, so let's talk about Medigap changes and trends. So all of you, or most of you that are on this webinar, are enrolled into your traditional Medicare benefits, and you have your supplement plan, which is also known as Medigap, and you have a prescription drug plan. We're going to run through some things that are changing that you need to know about, some of the trends, and really you're going to see the common denominators that everything is going up. So what we're going to take a look at is enrollment trends, rate increase trends, the birthday rule proposal, prior authorizations coming into traditional Medicare, and then we'll talk about a cost analysis long-term on Medigap versus Medicare Advantage. So this slide here might be hard to see, but what I want you to take and what I want you to take away from this is that if we go back prior to 2010, traditional Medicare was the preferred insurance program that individuals chose as they were coming into Medicare. So you can see about 81% of individuals that were eligible for Medicare chose traditional Medicare over going with what's known as a Medicare Advantage or Part C, which you can see was at 19%. With the way that it's trending, in calendar year 2022, they hit the crossroads. It started to flip. There are now more individuals enrolled into a Medicare Advantage plan than there are in traditional Medicare who are eligible for Medicare benefits. So today it stands as about 54% of beneficiaries are on a Medicare Advantage plan, and about 46% are on traditional Medicare, whether they chose to go with or without a Medicare supplement plan. And they're anticipating this trend to continue because the cost is just becoming so expensive. So if we can move through.
Yep, yep, yep.
So the most popular supplement plan that's in the market today is what's known as Plan G. There are individuals that may be fathered into more robust supplement plans known as Plan C or Plan F. But today, the most common and the most popular is Plan G. These last 2 years, we have seen these insurance companies filing for double-digit rate increases, where historically I've been in the Medicare space for about 15 years. Kim's probably been here longer than I
I'm
have.
the old timer in here.
It's historically been about 3 to 6% year over year for a Medicare supplement increase due to the cost of inflation and as you age. We are now seeing 2 years in a row double-digit increases. So if you see that one and the fifth one listed, that's Mutual of Omaha. They filed for over a 20% rate increase average across the country. Aetna's at over 15%. Blue Cross filed 14% last year. United Healthcare was at 16%. And we are anticipating that they are going to trend and continue to be filing these double-digit increases. And what I want you to understand is they don't make it easy for you guys to budget and plan ahead because all of these supplement insurance carrier providers choose different times in the calendar year
Yes.
to refile their rates. So for example, Blue Cross does theirs in April. So you won't even know what your rate increase is going to be until after the open enrollment period. And if in April you now want to change it to a Medicare Advantage plan, you can't. You have to wait till the next open enrollment period.
United Healthcare's in June. So we know that they do theirs in June.
Priority and HAP do theirs in January, so you will know if you're getting a rate increase before the end of open enrollment. Humana does theirs in May. Aetna does theirs in June. So you can see they all do these at different times, and it makes it challenging for you to budget and plan ahead. But just know that we are anticipating very similar rate increases as we go into calendar year 2026. And what is driving these rate increases? Let's take a look here.
Oh, there's Plan N too.
Plan N. So for some of you might be on Plan N, which is kind of a step down from Plan G, what you need to understand is that for most of the carriers, you're seeing double-digit increases as well. So why such large increases? The MLR, the Medicare loss ratio, right? So we are seeing an average increase from 2024 of 11%. And 67% we are seeing about 11% or 67% of plans increasing their rates over 10%, which is unheard of, right? Like I said, it was always typically in the single digit mark. They're now over 10%, and you're seeing some as high as 20%. So if we take a look at the MLR, it reached a 10-year high of around 86%. So for those of you that are not familiar with the terminology of MLR, basically that is premium dollars coming right? So if there's not enough premium dollars coming in to pay the medical claims, they're going to have to increase those premiums. United Healthcare is the largest Medicare supplement carrier in the country. They have more members enrolled in the state of Michigan in their supplement plan than Blue Cross Blue Shield of Michigan. So they typically are the leader in this space, and you can see that their MLR rose from 83% in 2023 to over 85%, adding in an additional $9 billion in cost. They're projecting to reach 87% by the end of 2025. Some of this big surge into utilization, just to kind of put this into perspective, where is this coming from? This is kind of the tsunami after the pandemic, right? When we were in the pandemic, a lot of folks had to kind of set aside their pre-scheduled surgeries and treatments like cataract surgeries and knee replacements. When that pandemic was lifted, now the hospitals and the surgical centers were able to start to do those procedures and treatments, and you saw a surge in claims coming through and claims being paid out. Birthday rule adoption is happening across the country. There's a proposal in Michigan, which I'll talk about that in just a second. And then incorrect pricing assumption, right? So these actuaries that study the claims and the dollars coming in try to make their best predictions, and sometimes they're just off. So they're seeing guaranteed issue numbers exceeding expectations, and whenever there's guaranteed issue numbers that are higher than what one expects, those typically tend to be sicker folks, which are more costly for the Medicare supplement providers. And then as you saw on that screen a few slides back, where it was the chart of kind of the crossing of the paths, more individuals are choosing Medicare Advantage as they're turning 65, which means less new blood is going into the pool of the Medicare supplement program to offset the sick with the healthy, which is driving cost up. So these are all some factors that are causing these premiums to increase the way that they are.
And not to mention, I've talked about it with our clients for a long time. We've had the silver tsunami going on for a long time, the baby boomers, lots and lots of baby boomers. And that has also really taken these numbers and taken them up as well. Just as Kevin has mentioned, we do have, there's quite a few sick people that are in the Medicare supplement space, which does affect all of this. From what I understand, 2025, I think, is the cap of the silver tsunami. And then, so that means the baby boomers have been going up, 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 and up. And now this year, it's kind of supposed to sort of level off and then slowly start to trickle back down. And again, that all drives these premiums to continue to move up.
Yeah, that's a great point. So let's talk about the birthday rule really quickly. We don't have this here in Michigan, so you probably aren't aware of this, but certain states have adopted this. And what this is that if a state that you see listed here has adopted this rule, any individual that resides in one of those states who is not currently on a Medicare supplement or a Medigap policy gets to pick up a Medigap plan or a Medicare supplement plan in the month of their birthday without any medical underwriting. So someone could be on a Medicare Advantage plan for 10 years. They could be, very sick, a high cost claimant. And once their birthday month hits and they live in California, they can say, I now want to go to Medigap. And they're not allowed to be rated up based on their health. Their rate is based on their age, gender, and zip code. So states that have the birthday rule tend to have significantly higher Medigap premiums because of this jumping ship back and forth, and it's hard for them to contain the cost and the utilization. We don't have this here in Michigan yet. However, there is a bill on the table here in the state that was introduced in November of 2024, which would allow some version of individuals who are already on Medicare to get a Medigap plan without any type of medical underwriting. There hasn't been a whole lot of movement on this bill, so I would say it's kind of in a standstill phase. But what you need to understand is it's being looked at and it's being introduced. And if this does come into Michigan, yes, there are some pros and cons to it, but you have to understand that if this passes, premiums will increase at a much higher rate. All right, so one of the things that has happened is CMS has come in, Centers for Medicare and Medicaid and said that they are going to introduce a pilot program for prior authorizations. So historically or traditionally, there's only been very, very few services that have required prior authorizations on traditional Medicare with the Medicare supplement. There, but as I mentioned at the beginning of this with the caveat, things change with the federal government. As it stands today, this is proposed to go into effect on January 1st, but at any minute, this could come off the table and not go into play at the beginning of next year.
So one thing I just want to interject, because I hear it from my clients and stuff that say, well, this, traditional Medicare out front is fabulous because we don't have to do the prior authorizations that you do hear about with Medicare Advantage. Well, when they start sort of talking about something like this, that is where we may see that start to happen with the traditional Medicare out front. So it may not be just Medicare Advantage. It's probably going to move into the traditional Medicare space as well.
Exactly. And so fortunately, Michigan is not in the demonstration program, so it is not going to impact our state this year. But if they start to see that this is working, it's helping cut down on fraud, waste, and abuse, it's helping protect the Medicare Trust Fund, I can anticipate, or I'm sure we all can, that they will be introducing this or rolling it out into new states as well. What you have to understand is really the main focus on this, and I don't know if a lot of you recall about a few months ago, the Department of, I can't remember what department in the federal government basically did a huge thing where they had busted a lot of fraud in the Medicare space around billing. You saw that with like durable medical equipment and skilled nursing facilities and telemedicine providers. And so when you're on Medicare Advantage, there's no oversight. They're submitting claims and the claims are being paid by both parties and there's no one really watching it. So what they're saying is we are starting to see that these procedure codes are coming in fraudulently or being overused or there's waste. We're going to put some measures, some authorization measures around these to make sure that they're actually needed and that they're being billed correctly. So they're trying to cut back on fraud, which is happening in the industry. And if it starts to work with these states and with this program, it's going to continue to roll out and it's going to be adding more procedure codes on with it as well.
And that is one thing that we hear, the prior authorizations, oh, it's such a pain. Oh, it's such a pain. It is, but they're trying to do it to ease up, just like Kevin said, really and truly on the fraud, waste, and abuse that's been happening in the Medicare space. So it is coming a little bit, but it's a good thing. But yes, it can be kind of a pain in the butt as well, but it is something that does need to be looked at. I just want to put my 2 cents.
Yes, and I want to say you guys can help with this too, in the sense to cut back. For example, I had a client who reached out to me this week who was on a Medicare supplement plan, and she says, Kevin, she goes, I never went in for this service or procedure. I have a code that's being billed. Medicare paid primary, my supplement plan paid secondary. I don't have to pay anything on this, so I'm not complaining about a bill, but somebody's paying this, and this is not correct because I never had it done. So look at those EOBs when you get them, explanation of benefits, from Medicare and from your supplement carrier to make sure that this fraudulent stuff is not being billed. And if it is being billed, report it so we can cut back on the fraud, which will help drive all of this cost down.
And the explanation of benefits is the paperwork that comes in that looks like it's a big bill, but it's not a big bill. It'll say this is not a bill at the top. So if you do start looking at those, don't freak out. Those aren't bills. It's just kind of to show you where they're saying or where services have been put through.
Yeah.
So it's good to start paying attention to those.
Okay, so I want to flip it over to Kim because she's going to go over what Medicare Advantage is. This is what you guys currently are not enrolled into, and this is what the alternative option is that you are eligible for. I just want to mention one thing before I pass it over. All of these commercials that are going to roll out, all of the advertisement that you're going to be getting in the mail, all of the telemarketing calls are around these programs. This is what's being advertised to you. So we want to make sure you understand what these plans are and how they work. So that way, if it's a good fit for you and this is the direction you want to go, now is the time to do that. So thank you.
Thanks, Kevin. So You know, with Medicare Advantage, we have this conversation a lot in the office, and I'm not advocating that it's time to make the change, but what we really want you guys is to just be educated on what it is and see if it would actually work for you. So, what a Medicare Advantage actually is, it's another letter. I always make a joke when we do these in-person presentations. It's just another letter to add to the mix. But what it does is you have to have original Medicare A and B. But when you have a Medicare Advantage plan, you actually put your paper Medicare card away because the insurance provider that we put you guys with, or the plan that we have decided is best for you, that becomes your primary insurance. And as you see on TV, and you guys will notice I kind of vary from these screens just a little bit, but as you're going to see on TV, it does include dental, it does include vision, it does include hearing, it does include prescription drug coverage. Some of the companies are still going to offer a zero monthly premium. Some of the companies are going to be adding monthly premiums. That's where we want you guys to rely on us to help find the plan that is right for you based on your needs. So there isn't a right answer, there isn't a wrong answer. This is just a conversation that we would be happy to have with you if you're truly, truly interested in looking at this scenario. Like I say, I'm really good at kind of jumping off on these, but in a later screen, I want to talk about a trial rate that I'll get to on a later screen. So what it does, it combines your plan. It kind of turns it back in to when before maybe you were working and you had one plan that encompassed everything, and you had a copay for a primary care, you had a copay for a specialist. One of the things that's nice about Medicare Advantage plan is if you actually have a hospital stay. Previously, back on some of your plans that you used to have, whether it was employer or on your own, you typically had a deductible that you had to meet first. So then you seemed like you had a big, huge hospital bill. Well, what a lot of these plans have done is they have taken away the medical deductible. And these plans are based on individual copays. So when we talk to you guys about that, we can kind of give you a sense of what some of these procedures might be. A couple of the companies have zero copay for lab work, zero copay for primary care. A couple of the plans have Delta Dental built in. You know, again, we don't have all of the details, but it's time to really think a little bit outside the box and see if this is something that may fit your needs. If not, there's no push to make you do it. It's just education on our part, you guys, our valued clients. And the other thing I want to say about the phone calls that Kevin kind of mentioned is please, 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 during the open enrollment, be very careful about picking up the phone calls. There is going to be a lot of call center solicitations going on. You're typically going to get to somebody that is not in the state of Michigan. You may never get to that person again. So just be very careful with answering those calls during the upcoming open enrollment. And as I'm going to reiterate, we all know, well, maybe we don't all know, but that starts October 15th and it ends December 7th. So this is where I go off on one of my little tangents. So just be aware of that time frame. It is a very tight time frame when we're trying to work with everybody to make sure we get you exactly where we're going to be. So if you really and truly think that you want to look into this, I'll show you a QR code at the end. If you really don't think you want to do it, then just make sure we check your prescription drug plans.
Yep.
I just want to add on to that.
Yes.
Just like Tim said.
This is not a sales presentation. We're not saying this is the direction you need to go. This is to educate you so you can make an educated decision about your healthcare as you go into the new year. We have a fiduciary responsibility to put you or help guide you to really where you need to be. Medicare Advantage is a good fit for a certain person. It might not be the best fit for the other person. So the intent of this presentation is just to give you the education so that way you understand what is available to you as you enter this open enrollment period.
And as clients of mine, clients of Kevin's, you know, we do write for all the insurance carriers. So we are going to take the first week, at least we are in the office, we're going to take the first week, we're going to learn those plans so that we can better educate you guys on the plans from the get-go. So just kind of be a little bit patient with us that first week, but we will be learning the plans so that we can educate you guys better. Kind of like I said, there are extra benefits that Medicare does not cover. So if you are on a Medicare supplement plan with a standalone prescription drug plan, you're carrying 3 cards at the moment. If you go to a Medicare Advantage plan, like I said, you're going to put that paper card away. You're going to carry your one insurance card, and that is what you are going to use for these added on benefits. Most of them have the gym memberships that everybody likes with a couple of the different carriers. The dental, we've had beautiful response with the dental plans because I have a lot of Medicare supplement clients that are like, well, gosh, I would really like dental. Then you add on the drug plan, the Medicare, the MedSup, and now you throw in a dental plan as well. Again, hence things start to become a little bit more expensive. The other thing I want to kind of throw out there a little bit, I don't necessarily sell on this. I know Kevin doesn't either, but there are what's called over-the-counter benefits that are built into these plans where you can get a flex card, you can go into your local pharmacies, you can get Band-Aids, toothpaste, different things. Some of the companies have made those very few, a lot of benefits over the last couple of years. Some of those companies might be pulling those back a little bit more this year. So that's not our main focus. Our main focus is the healthcare for you guys, and then we can kind of bring up those over-counter allowances. Anything you want to add to that? Or
Yeah, and I will just say this because sometimes I'll have clients who, will question these supplemental benefits and things that they're seeing online or advertised or through Facebook marketing or whatever. They are comprehensive, right? Some of the dental plans will give you coverage up to implants, right? So, I mean, it's not just your cleanings, your x-rays, and your exams. So, I mean, when you look at your healthcare as a whole and the overall cost, that factors into it. If you're paying out of pocket for it now, and you're looking at this type of plan, it's now starting to include that. You need to put that into the equation of what that cost comes out to in a year. So it's not all of them, but some of them do have very comprehensive benefits to where it can give you coverage, up to implant coverage.
so some of the key differences that we hear out there, and that we're going to show you here on the screen, when you have original Medicare, you do know that Medicare is the primary insurance. It is out front. And then we add the Medigap plan in there to pick up where Medicare leaves off. When you look at a Medicare Advantage plan, that is going to be by a private insurance company, whether it be Blue Cross Blue Shield, whether it be HAP, Priority Health, Humana, United Healthcare, all of those guys. Everybody has their different types of Medicare Advantage plans that we can certainly talk about with you guys. Like I kind of already said, sounded a little bit like a broken record, but the drug coverage, when you have a Medicare supplement or Medigap, you know that you have to have a separate prescription drug plan. Hence, that's where you're carrying the 3 cards, the Medicare card, the supplement card, and the drug card. With Medicare Advantage, it's often included. Now, there are some Medicare Advantage plans that are really great for vets that doesn't include prescription drug coverage because they get their medications through the VA. So we have those that we can work with people that are vets as well, and those guys actually get to benefit from the dental and the hearing and some of the extra benefits that are in those plans. With original Medicare, you can see any provider in the United States that accepts Medicare. With a Medicare Advantage plans, it's like going back to the old employer plan where you do have a network. I want to point out, we will never, ever, ever make you guys change your doctor. That's why we send out the QR code. That's why we want the updated information every year. If you are interested in this, we will keep your doctors. I don't want that to be a worry about. I've had that come in a couple times this week. Well, if I look at those, do I have to find new doctors? Absolutely not. We will find a plan that your doctors are in, and it's really not that hard. Prior authorizations, as we talked about earlier, they may be coming, even though Michigan is not there yet. They may be coming. With Medicare Advantage, yes, we have heard some prior authorizations this year. But again, as Kevin and I both mentioned, it's really to be a positive, not to be a negative. It's to help Medicare stay fully funded. Solve it. Good word. Copays with Medicare Supplement Plan F or Plan C or Plan G or Plan D. There are no copays. You're going to pay that Part B deductible, which Kevin went over this year. Unfortunately, that's going to be going up. On a Medicare Advantage, you will pay copays on some services, and it's broken out really, really nicely. You do understand where your copays are going to be. Out of pocket maximums. There is out of pocket limits on the Medicare supplements, which is the Part B deductible. And on the Medicare Advantage, there is also an out of pocket max. Now, what I want to kind of throw out there, and it might be another slide, but just remember when you're looking at these two types of plans, with Medicare supplement, I break it down and make it super easy. You are paying for your health care because you are paying that monthly premium to not have to pay a copay. Okay. On the Medicare Advantage, where there is no monthly premium, now you're going to pay for your health care as you utilize it. So 1 year prepaying, 1 year paying as you go. And I've had a few of my clients that are really sweet that have called in and said, you know what, Kim, I did open up that savings account on the other side, and I did take my premiums that I was paying for the Medicare supplement, and I kind of have a nice little savings account set up if I need to use those services. So my clients, I'm sure Kevin's clients, I mean, we are very crafty in coming up with different solutions to try to make these things work for you. But it might be time to just get a little bit more open-minded about it. You get to talk about this one.
So I'll just talk about this really quickly because I want to give you some factual information or some studies that have been done. So Milliman is a consultant firm, which is basically
that a lot of these insurance companies use to predict future costs and rates for their plans and so forth. So Milliman did a study, they do it every year, on the two pathways, right? Someone who's on Medigap with traditional Medicare and a Part D,
and then someone who is on Medicare Advantage. Now, I want to mention, this is a
healthier individual, right? Not with certain chronic conditions and things like that. Not someone who isn't taking no medications and doesn't go to the doctor, someone who moderately uses their healthcare. This is giving you a study showing you what you would be spending on healthcare expenses going path 1, which is the Medigap route, versus going path 2, which is Medicare Advantage. Now you can see they break it out between male and female. And so for a 65-year-old male retiring in 2024, on traditional Medicare with the supplement in Part D, the average cost would be about $281,000 out of their pocket. On Medicare Advantage, $128,000. For a female, you're looking at $320,000 would be the estimated cost for the first path with Medigap, and $147,000 for Medicare Advantage.
I want to throw in one thing because I didn't realize it earlier, but we as females, we live longer. So I asked Kevin myself, I'm like, wow, that's a big number for females, but we do typically tend to live a little bit longer. So that number is pretty dramatic.
Yes. And so what I try to share with people is that you will save money on a Medicare Advantage plan. I don't want to say I prefer a Medicare Advantage plan over a Medicare supplement, but if you're looking at, okay, where would I save the most money? Whether I know I'm going to pay up front to not have to pay when I go in and use it, or save my money and pay as I go. Statistically, you will save money on a Medicare Advantage plan. You just need to be comfortable and understand how it works to make sure that it's a good fit for you. But we just wanted to share with you some data in regards to a study that's done every year around these two types of programs and how much people will spend over the time that they're on Medicare.
So this is a very, very important feature. We talk about it a lot with our clients, and it is called a trial right. If somebody, I'm just going to say Mary Jo, if Mary Jo calls me and she says, you know what, Kim, I'm interested in looking at a Medicare Advantage this year. And I say, you know what, Mary Jo, this could be the year to do it because you've never been in a Medicare Advantage. She's never tried it. So she says, all right, let's just give this a shot. So we switch her over. We move it for January 1. 2026, any time within that 12-month period of 2026, if you, for some reason, do not like the plan, we can put you right back to where you were. You can go right back to the Medigap Plan G, Medigap Plan F. We do have to show them some paperwork that you did have that the prior year, but you can go back. You can pick up that prescription drug plan. You can utilize that trial right. Another thing that's kind of nice is sometimes you don't necessarily have to go back to that specific carrier that you were with before. So if we can find something that has a better premium for it, that is also part of this trial right. So a couple years ago, I had quite a few people that we did that trial right with, and honestly and truly, not a single one of them went back to Medicare supplement. So as long as we, Kevin and I, Marlena, Andrew, as long as we do our job and explain these plans to you guys clearly, and we are right there to help you if anything comes up, you may have a good experience with trying the Medicare Advantage plans. I have lots and lots of clients that have enjoyed that. They've loved the dental, they've loved the vision. So this trial right is something that's very important for all of you guys on the call that have never had a Medicare Advantage plan. This is a good way to try one.
Yeah, so just think of it as a test drive, right? So there's some of you on this webinar that are saying, nope, I don't want a Medicare Advantage. It's not for me. This has been great information. And there are other of you that are on the fence, right? That does seem intriguing. I think I might be a good fit for that, or that might work for me. Well, you can try this type of program out. And if at any point in the first 12 months you say, you know what, I was wrong, this wasn't for me, you get to go back where you were, no underwriting, and they have to charge you the rate they were charging you prior to leaving. So you have protection to get back into a Medigap plan if you want to try a Medicare Advantage plan.
Perfect. So what's the next steps? And we will answer some questions when we're done with this. I'm going to be a little bit adamant here. If you truly, truly, truly think that this is something that may fit for you, we would love to have you guys scan this QR code. If you have problems with QR codes, you can certainly call the office. You can call my office. You can get a hold of Kevin's office. We can get you a link to update everything. But if you think you're really interested in this, please scan the QR code. Once we know what the plans are, is October 1st next Wednesday? It is, right? So, okay. So next 1 week from tomorrow. So next Wednesday, when these plans become live, we will be able to look at these plans. We will already have your information. And then that's way we can kind of get through these and see if that's going to be a good fit for you or not.
Yeah. So if you are interested, like Kim said, if you could please fill this out. Once we get your submission, one of us from the office will call you to let you know that we received it, give us some time to sort through it, and then we would be following up with a time to schedule an appointment to go over the quote to see if it makes sense or is a good fit for you. The other thing I want to mention is that there are some of you on this webinar that don't want to go down this path. And I completely understand that, and that's personal to you, and that's the decision that you make. However, what we also do is we have helped our clients shop their Medigap plan, their Medicare supplement plan, because you are allowed to reshop your Medicare supplement plan and apply to a different carrier to try to get a lower rate. But that is really going to benefit or be ideal for someone who is in fairly good health. Meaning if you have chronic conditions and you're taking certain medications for certain chronic conditions, you wouldn't pass the underwriting process to get another Medigap plan. But if you're someone who maybe takes a few blood pressure, cholesterol, certain medications, your BMI is in good statistics, you're not smoking, you can reshop your Medigap plan, get the same exact coverage for a lower rate. Think of how when you shop your home and auto insurance, it's very similar. So I just want you to know is really the goal of this is to educate you to understand that there's cost to a lot of this, that it's going up. And if you're starting to look at those numbers, there are solutions and we will work with you on whatever direction is best for you. So Just to recap, if you are interested in Medicare Advantage and you really, really want to explore this, please fill out the QR code and we will follow up with you. If you want to relook at your existing situation to see if you're able to make it through an underwriting, we can have a quick conversation to let you know if it's worth a shot, or no, you will not pass underwriting with another supplemental carrier.
And the one thing I want to interject with that too is Medicare supplements. Those can be changed anytime throughout the year. So, not that we won't do it during open enrollment, we can certainly have that conversation. But if you say, you know what, Kim, let's just look at that in January when we've got everybody else's new rates, we can do that. It can be something that can be changed all year long. So I just kind of wanted to throw that out there a little bit. So now, now we're going to go to question and answer, which I don't know how to necessarily do that. But, the timeline, again, guys, October 15th through December 7th. We try to get everybody done by 5 o'clock on December 7th. Actually, we really try to get everybody done by December 1st so that we in the office have time to double check everybody and make sure that everybody's enrolled and all that good stuff. So, okay. The first question, will you send the slides out to attendees? If you request that, we can do that, right?
Yes, so we can look at
Sending those out. This presentation is also being recorded and it will be available to download or to view. So if you have a relative or a friend or anybody who you feel this would be helpful to listen in on, this is recorded and we can get you the link to where you would be able to see that. So yes, we can look at getting the slides available as well.
So in some of the questions, I do see that we cut out on certain things. Jackie, you can call me at the office. You can ask me those questions kind of if we went in and out. I'm certainly happy to discuss those with you.
Yeah, and if anybody is wanting to,
ask these questions now live, we can just raise your hand and we can turn your mic on and you can let us know where we were cut out and we can address that or reach out to us after.
Here.
Let me go to this one. We were discussing the WellCare 615 minutes. Okay.
That's she addressed right there. So Jackie, let me just address what I was saying because that was what I was discussing. So WellCare Value Script currently for 2025 has a $0 Part D plan. Currently, it's set up to where it has a $595 drug deductible that applies to tiers 3 through 5. That plan is still going to be available next year. The Part D drug deductible is going up to $615, but the deductible is going to be subject to tier 2 through 5. So if you are taking any tier 2 drugs, you are going to have to meet your deductible next year, where this year you did not have to meet that deductible.
And that's what we'll be checking for you guys. You know that we've kind of sent the forms out. Pete, I can see where you wrote in there. Have the mailings been sent out? Yes, we did send out our mailings, but I can certainly send you the link in an email as well. So Pete, I do see you there, so we can get that over to you in a link.
We'll go to the live question. Ronnie, if you we'll open the mic, and if you want to ask the question, we'll be glad to address that.
Give us one. There you go. Hi, Ronnie, you're on.
I think you're unmute your mic, and I think you'd be able to. We've opened it up for you to ask a question. Oh yeah, go ahead. We can. I think you should.
Can you hear me now?
Yes.
Okay. If I'm hearing you right, and I may have heard this wrong, if you're considering the Advantage plan, do we have to go through underwriting if we have prior medical conditions to be approved for it?
Not on a Medicare Advantage plan, Ronnie. There's no medical underwriting on that. On the Medicare supplement, after your 6-month guaranteed issue period, that would be medically underwritten if you want to go from, I'm just going to say Blue Cross to HAP. But on a Medicare Advantage plan, no, there is never medical underwriting on that Advantage plan.
Okay, thank you.
You bet. Thanks.
So just to reiterate, on Medicare Advantage, the rate that you are charged is strictly based on your zip code only. Age, gender, health, the medications you take, whether you smoke or not, none of that is ever a factor. Your rate is strictly based on your zip code. So I would like to use the example as a 65-year-old male who is perfectly healthy, living next to a 90-year-old male who's chronically ill and in and out of the hospital. You pay the exact same rate and your benefits are the exact same. We have we have a few more questions we're gonna go over. Just about mailing.
Yep, just about. So anybody in here that's saying about the mailings, they have gone out. If you have not received it yet, just give the office a call. We also just have a link that we could email out to you, but most of those mailings went out towards the end of last week. So you should be receiving those this week.
We have another question about what are the over-the-counter benefits? So those are supplemental benefits that are included into the Medicare Advantage plan. Most of them, not all of them. Basically, what it is you get a flex card, like a little credit card. You're able to go into certain participating retailers and buy over-the-counter items. So if you've ever been into like a CVS and you see like the little blue sticker that says OTC eligible, those are the type of items that you're able to purchase with that card that is preloaded with a set dollar amount. And that benefit typically reloads every 90 days on the plan. So Medicare Advantage plans, I just want to kind of put this into perspective. They are extremely focused on wellness. They want you to get your teeth clean. They want that eye exam. They want you to take your vitamins. They want you to go to the gym because the healthier you are, the more money that they make. And you're probably wondering, how do they make money if it's a $0 plan? We will have that conversation another day, but they're very focused on preventative and wellness. So they want you and incentivize you to go and get those vitamins, and that's how that benefit works. Right here.
Let's see, in Medicare Advantage plans, Part D, is there any? Sorry, my eyes are horrible. Includes, go ahead.
Is there any plan that includes WellCare as its Part D plan that built into the plan? And can dental plans not be included if you like a separate plan you currently have? Do you want to address that?
Well, with Medicare Advantage plan, Janice, it's not going to be integrated with WellCare. WellCare has their own Medicare Advantage plans, but if you happen to, I mean, if you looked at WellCare, then you would be working with WellCare. But the Part D drug plans are typically not the same as the Medicare Advantage formulary drug plans. I'm going to make this sound a little bit confusing, but they cover different medications within those types of plans. So no, if you did a Medicare Advantage plan, I can't say you're going to get WellCare as part of that Part D plan. And then as far as the dental plans that are included within the Medicare Advantage plans, we would actually talk about that because a couple of the carriers actually have Delta Dental, but there's no way to pull it out. It's in there.
Yep. So let me also address a couple of things. So the Part D on Medicare Advantage is built in. So you're not carrying a separate card. It's built into the plan that you choose. So if you choose Blue Cross as your Medicare Advantage provider, they're covering your prescriptions along with your medical, along with your hospital, all in one. Regarding the dental, just keep in mind, if you want to keep your standalone dental plan, but your Medicare Advantage plan has dental coverage built in, you can have both plans. These dental offices are savvy. They are going to bill one of the plans to the maximum, and then they're going to say, oh, I see you have another one. Then they're going to start to bill the next one. So you can have both, but you can't carve out a dental plan from a Medicare Advantage plan if it's included.
They're all in one. It's an all-inclusive plan. So you're going to get what's in that plan. So thanks, Kevin.
Yeah, so let's go to this one right here. Let me read it, then you'll answer.
Yep.
What is a Medicare Advantage plan pay as you go costs and co-pays?
What do those look like?
High pay. So that really is like most of them for 2026 are still going to have a 0 monthly premium. So the cost, all you're going to be paying is the Medicare Part B premium to the government. Most of them are going to have 0 premium. I
Yes.
mean, as far as we know, we don't have all the plans yet. Now, copays, they do vary. Off the top of my head, this year, I know that with a couple of the plans, like I said, 0 copay for your primary care physician, which we check those on everybody. Typically, it's about a $35 to a $45 copay for a specialist visit. Some of the plans, like I mentioned earlier, 0 copay for blood work. If you needed an MRI, that might be a $275 copay. The big one I always like to point out to people is the hospital copay. So that is broken down to a per day charge. I'm not sure what it's going to be for 2026 yet, but this year, one of the plans is $325 per day for days 1 through 5. So if you have a hospital stay, the most you can spend for that while you're in the hospitals is $1,960. So that's actually pretty reasonable. And then on a Medicare Advantage, I'm not sure what they're going to be for 2026, but some of the maximums that you could pay, $5,300 would be a max that you could pay. Blue Cross Blue Shield, they are at $6,250 for this year. I'm not sure what they're doing for next year, but this is all stuff that we're going to have.
Yeah.
And
And I also got a couple things to that. So some of my clients are here on this webinar, and I usually share this within my presentation and when I meet with my clients. But for those of you that don't know me, prior to being a broker owning my agency, I worked for the health plans. I worked for Blue Cross Blue Shield. I worked for Priority Health. That's where I met Kim. I worked for HAP. Why I bring this up is that I've seen these plans and how they work. I've seen the claims data, the utilization. Less than 3% of people on Medicare Advantage plans across the country ever hit their out-of-pocket maximum. It is extremely rare based on the way the plans are designed. Typically, you see the maximum being hit if you are on end-stage renal disease, so dialysis. If you are taking Part B drugs, such as like infusions and injections, and if you have a very long stay in a skilled nursing facility. But if you have one admission, if you have an MRI, or if you have cataract surgery or a knee replacement, you will not come anywhere close to hitting your out-of-pocket maximum. So I just want you to know the copays vary depending on the plan, the carrier, and so forth, but it is very predictable. You'll see if I'm going to go have my MRI, what is it going to cost me? You're going to know the copay. It's not a percentage, it's a flat dollar amount.
And the only other thing I kind of want to throw out there a little bit too is the other thing we're going to be able to do is we can get all of your questions that you guys are kind of putting in here too. We can get them emailed to us so that we can make sure that we can get back to you guys as well and really clearly answer your questions. But, a lot of times Medicare Advantage plans get a bad rap. How do I want to say this? Because some doctor's offices say, oh, keep original Medicare out front. It's this, it's that. A lot of times, what did we say that earlier? It goes in regards to the billing and stuff like that, where Medicare Advantage kind of gets the bad rap.
It's just typically the provider office for certain services has to take that extra step for prior authorization, and they want to hit the easy button and not have to deal with authorization. So it's really understanding, but what Kim said in the presentation is she hit the nail on the head. Medicare Advantage plans are identical to what you had when you were covered through an employer at some point in your life. When you carried that Blue Cross card, when you worked for your employer, and you went to the hospital, the doctor, the pharmacy, the dentist, that's how these plans work. It's the same concept of bundling everything together. Okay. To keep moving along, there is a question in here that says some Medicare Advantage plans stopped coverage. Do you have an outlook for this in the future? That's a very good question. If you don't mind.
Go ahead.
I'd like to take that one. So this year, I'm not going to name names just because I, out of respect for the insurance company, there's an insurance carrier that is closing down 64,000 Medicare Advantage contracts across the state of Michigan. Okay, you can open the articles in the news and hear it across the statewide. These are year-to-year contracts, and the insurance carriers have the ability to make changes to them or take them out of the market. What you need to understand is those 64,000 people that are losing their Medicare Advantage plan here in Michigan have two choices. If they want to go to Medicare Supplement, they can. They'll get a guaranteed issue. Because they lost that Advantage plan to no fault of their own, they can shop any Medicare Supplement plan sold in Michigan, and the rate is based off their age, gender, and zip code. So if that happens, you have protection, one, to get Medicare Supplement with no questions asked, and two, they have the ability to reshop and find a new Medicare Advantage plan that is going to be available in the area. So when you see these stories and these articles of Advantage plans pulling out of markets and closing down programs, there is protection for the Medicare beneficiary that gives them basically the ability to shop again, to almost as if they're turning 65 and reevaluate what they want to do. So if it happens, you are protected.
And we are aware of this. So any of the clients that is going to happen between our two agencies, we are completely aware of this. We will be reaching out to you guys. And I'm going to tout us. That's the value of working actually with an independent agent, because if you just work with one of these companies and you don't read the news or the annual notice change that comes out, there's somebody that could miss this because they're not reading exactly what's going on. We are aware of this. We are reaching out. So anybody that's on this call, don't worry. We'll be able to help your friends or family. We are aware of what's going on.
Another question about what about travel coverage under Medicare Advantage? I'll let you take that, Kim.
So on some of the plans, actually have built-in travel coverage. I'm just gonna kind of throw it out there. HAP does have Assist America built into their plan. So all of these plans do have worldwide emergency coverage. HAP just happens to go the extra mile, and it's called Assist America that's built in there. They can help you coordinate care. They can help you find your luggage. Just a little joke there, but that is incorporated. Whereas with the Medicare supplement, as many of you know, you are capped. You have a $250 copay, and then it's capped at 50,000. So most of you guys know to call me, and then we put a Geo Blue plan on you. But that is definitely something we can discuss when we start looking at these different plans for you guys, if you're interested.
Yep. So really long story short is that Medicare Advantage has a richer foreign travel benefit than Medicare Supplement. Supplement is limited to a $50,000 lifetime maximum. On the Advantage plans, if there's a cap, it's an annual cap per year. Most carriers don't have a cap for ER and urgent care outside of the country. So it is a richer benefit for foreign travel on Advantage versus Supplement. Next one, Medigap is national network across the US. Are there any MAPDs that have a national network?
Yeah, actually, some of the national carriers actually do. So you've got your Humanas, you've got your Aetnas, and some of them here in our core guys, Blue Cross, HAP, or Priority Health, they actually do have travel benefits built into those plans. Some of them have travel benefits to Arizona, Florida, Texas, mostly where the snowbirds go. But just remember, when you have a Medicare Advantage plan, you have emergency coverage wherever you're at. I tell my clients, God forbid, if you're in, I don't know, Albuquerque, New Mexico, or something like that, and something happens, as long as you walk in through the ER and you have a Medicare Advantage plan, it is going to be treated as in network.
And an example I like to give here, because that's a very good question, is let's think about the time you were employed at some point in your life and you carried a Blue Cross Blue Shield card in your wallet. Remember, if you were on a PPO, you could go and use the Blue Cross providers across the entire country. If you're on Blue Cross Blue Shield of Michigan's Medicare Advantage plan, you get to use the Blue Card Worldwide plan and see providers outside of Michigan. I'm just picking on Blue Cross as an example because I think all of us probably had that in our wallet at some point in our life. But there are a lot of carriers that give you national access of providers and doctors and hospitals across the country. Really good question here. Does the cost of Medicare supplement plans increase when you are required to take your RDMs, so the required monthly distributions out of your retirement or investment accounts? No, your supplement rate is not impacted by your income. That is going to impact potentially your Part B premium and your Part D premium. Those are the only two that would be impacted if you start to have to take required minimum distributions and you go above the IRS thresholds for the IRMA limits. I scan the QR code. What is the website that I get directed to?
It's called Retire Flow, and that is what Senior Benefits Plus, Cox Hayward, that's where we're capturing your information. It is a secured, actually, link. And then goes into our CRM system where it's updating your medications from last year to this year. So that is a secured link to our companies.
Easiest way to put it is this is a secured link that gathers the information that we need to run you a quote. So it is HIPAA compliant. It is secure, but it's basically a survey that you're filling out to give us the information that we need.
This one right here. I'm 66, never had Medicare, still working, have health insurance. However, I was told by ER to enroll into Medicare. I am not sure when to start for enrollment. Jackie, that's a separate question because if you're still working, there's rules that go on to that. If you'd like to reach out to either Kevin or myself, we can kind of walk through that process and kind of figure out
Yes.
what you're thinking about.
So one of the things, Jackie, I just want to mention, if you're not familiar with brokers such as myself, Kim, Marlena, Andrew, we are a local resource locally here in the community, and we help folks understand these questions that you're asking, help you understand the programs. There's no fee to use our services.
Yeah.
So that is a very unique question where we would have to get more understanding of what your situation is to kind of advise you on what direction you need to go and what steps you need to take. So if you do feel that you could use our services, please reach out to one of us and we will be glad to assist you with that.
And then I do see where you guys are interested in the recording, so no problem. We'll get a list of who's all on this and we can get the recording back out to you. Can a Medicare Advantage plan be used when traveling in other states? Yes, I kind of went over that. God forbid something happens, as long as you go in through the ER, you will be treated as in network. So that's a good question, but yes. If I go to Medicare Advantage plan, I'm assuming Social Security is still going. Yes, they are. You have to still pay for Medicare to the government. You don't get away from that. So you're going to still keep Medicare Part A. You're still going to have Medicare Part B, and you're still going to pay that Medicare Part B premium. So when Kevin was talking about how that's going to go up this year, that you still have to pay.
Yeah, so just to make sure everyone understood the question, if you are currently on Medicare supplement, you're paying your supplement premium and then you're having the Part B premium either taken out of your Social Security check or you're getting a bill from Social Security. If you move to Medicare Advantage, you still have to pay the Part B premium.
Correct. You cannot get around that.
And there's just a couple more questions, and then Jackie, I see your hands raised. We will
Yep.
address that. Go up for a second.
Right here.
Given Medicare Advantage is a network, do most doctors accept this plan? Have people had trouble finding doctors within these networks?
We work really hard on that. Like I said in the whole presentation, we will make sure that your doctor's in the network, and in the Medicare Advantage space, they are very robust network. I do get this question asked all the time. It says, well, what if I want to see a doctor? That's, I don't know that I need to see this doctor yet. Sometimes you're not going to know what specialist you need to see. And we can actually help people find specialists so that they are within your network. I've done that for numerous people. So we will never, ever, ever make you lose a doctor. And we will search your doctors. We will make sure your doctors are in there before we present a plan.
Janice, I'm going to unmute you so that way you are able to ask a question if you need. I hope we addressed what you were asking, but you have the ability to unmute your microphone and ask a live question if you need to.
Are you there?
Okay, if you still have a question, you know how to please reach out to our office. We will address whatever concern you have. Like I said, we would need more information on your situation to really give you professional advice. So with that being said, I believe we addressed everybody's question. If you did not get your question answered, feel free to reach out to us. We will make sure that the webinar is available. That's going to be recorded. If you want to share it with other folks or if you want to listen to it again. And then we will look at seeing if we can make these slides available to share with you as well. Outside of that, I would like to thank you all for attending. Hopefully you found this information valuable as we go into the open enrollment period here starting October 1st. We are here to help. This is what we do. We live, eat, and breathe this. So we want to make sure that you are squared away for your healthcare in the upcoming calendar year. So thank you all. And
we totally appreciate you guys being on this webinar. Great questions. Again, we're kind of starting to be in the office 24/7 now. So anybody that wants to have a personal conversation with Kevin, myself, Marlena, any of the other agents, we can certainly take care of that for you. Our goal, as my clients know, and I'm sure Kevin's clients know, the goal is to take great care of you guys. That's why we do so much to try to get the information out to you. We send out our mailers. We want to take care of you. So don't be afraid to call, text, whatever we need.
awesome.
Looking forward to working with everybody. Hopefully you all have a good rest of your week.
Yes, thank you all for attending.
Everyone have a great day.
Bye-bye.